So it is my honor today to share my research ideas and the finding relative to Timebank. I'm not sure if you may heard about Timebank, or if you haven't know about that, I can explain a little bit. But for the background, actually, we focused on how to promote lay life volunteering, because the importance of the lay life volunteering has the substantial economic impact. And the most important thing is that there's quite well-established evidence that if the older people consistently volunteers during the later life, actually they can get substantial health and well-being impact. So one of the examples is that the volunteering is associated with the reduced risk of all causes of mortality, and not mention about the functional maintenance and the mental health and cognitive functioning. And as well as in addition to the economic impact, health impact, actually the social impact is well noted. The volunteering can benefit the society because when the older people volunteers, they get a health benefit, and then they can reduce the healthcare costs, which can be help to substantialize or help to improve the financial sustainability across the health and social care systems. So, and the WHO also calls for the initiative to facilitate lay life volunteering to promote healthy aging, because they well recognize that lay life volunteering can be the health promotion. And there's many discussions to use the volunteering as part of social prescribing for the older people. And the researchers also seek to understand and promote a pathway that can increase large-scale lay life volunteering. So one of the potential solution is time banking. So time banking is a form of the community currency. So which means that the members in the time banks volunteer 1 hour to the community. They can get one-time credit back, and they can use the time credit to ask for others' help or the service from other organizations. So for example, it is that Jinghua can help me to do teach me the Instagram, how to use the Instagram. So if Tracy is the older people, okay, older person, and Tracy can help Jinghua to cook, okay. So this is a skills exchange and mutual help circles, but they use time currency instead of cash to make that such kind of the transactions. So there's many 5 core values within the time bank model. So the one is everyone recognize everyone is an asset. This is quite important for the older people, because in quite real setting, older people are viewed as the passive recipients. And then redefining work, which means that community contribution and community participation, it is really have the value within the system. And reciprocity, which means that I help you and you help me, and each one help each other. And social network and respect. And in the real world setting, the time bank have been integrated into the public funded long-term care system, because if you have some knowledge about the Hong Kong situations, older people, if they are access to have if they ask for help in terms of the long-term care need, they have to wait more than half year to get the public funded community and home-based care service and the residential care. And one of the potential innovative strategies to promote lay life volunteering is to use the time banking, and this is also recommended by the WHO. And time banks models have already spread out over the world. However, so go back to Hong Kong. It is that when you look at the volunteer rates among the people aged 50 and above, you amazingly low. So how to do this? This one. Forget about it. But the percentage is around 10%. Okay, it is around 10% in the past 5 years. So much lower in the North America and the Western Europe. So which the rate was around 30 to 40%. So much lower. So of course, there's many relative factors to influence their participation in the volunteer work. So go back to the literature review, because the time bank used the time credit to reward people's volunteering work, right? So you may have questions like, all right, so Actually, when we look into the literature, there are two competing theoretical perspectives regarding how rewards or use the time credit to influence the late life volunteering. The first one is social exchange theory. So the theories have assumptions that individuals who perceive under benefit compared with the giving are more likely to leave the relationship and feel treated unfairly. So therefore, if a time bank can offer individuals to volunteer, can facilitate individuals to volunteer more and have a greater intention to continue volunteering through rewards, because you give them additional reward and then they will more willing to maintain the social relationships and to participate in volunteering work. However, when we look into literature, we found the motivation crowding out theory, which means that external rewards, external interventions, and the tangible incentive rewards, whatever, actually can undermine the intrinsic motivation and thus will hinder those pro-social behavior. And in the past, most previous studies found that if I give material incentives, actually it's not successful to encourage the participant rates in the pro-social behaviors. So if a time bank is promoted as one of potential solutions to promote late life volunteering, we have some concerns. While there's some existing literature indicates community currency or time bank system have the potential to improve the volunteer participation, it remains unclear regarding whether that kind of approach truly increase volunteering engagement or just replace other forms of civil participation. Right? Whether I give you the reward, whether it will be attract your participation from others, just replace others. So if so, there is no meaning to introduce the time bank. And the second research gap relative to volunteering and the time bank, it is that in the past, traditional volunteering quite requires individual to have time, have the wealth, and have energy, have education. So which means that older people have great resources, are more likely to volunteer, and while those with few resources may face exclusion, especially when the older people have advanced age, with lower education, with lower income status, and with more health conditions, they are less likely to volunteer, because volunteering actually require human capital and social capital as well. So time bank might be an alternative, because time bank from the previous studies, they claim, time bank can engage hard-to-reach population because the time credit systems in the time bank can facilitate access to service and personal development for the marginalized individuals. So think about one case is that if I am an older person with multiple health issues, if I join the time bank and earn the time credit, I can use the time credit to get the service from others if I need. Like medical escort, or ask someone to to go shopping, to buy the grocery for me as well. So this is, but we observe that there's some research gap here. While time bank promise to enhance volunteering, there's still uncertainty whether it mitigates the social inequalities in volunteering. It just makes it worse. We have that kind of questions like this. So the third research gaps we found it is that how time bank influence the healthy aging in the later life. So we use the quality of life as an index. Here we observe the search the literature and found that there is a well-established evidence relative to volunteering and the quality of life in later life. However, we are not sure whether the time bank can facilitate volunteering and then further to improve the quality of life in older people. I will just put it in a simple way like this. So we have the research questions and hypotheses, but I will just skip it because I explained the research gap before. I explained the research design. So this is Quasi-Experimental design, and then we have the time bank group, and then we have the control group. as well. So we have the time bank groups, and then we have the comparison group. We have the inclusion criteria. It is older people age 50 years and above and something. So you can read the slides. And then we set up our time bank model like this. So for the time bank group and the comparison group, there's 3 components. For the first two components, over their side, for the first 2 components, they are the same. Only the differences between time bank group and comparison group is that we provide the time credit for the time bank group, and there's no time credit for the comparison group. So we recruit the time bank group and the comparison group through the community center for older people, and then we trained both the participants in both 2 groups with the 4 3-hour knowledge and the skill training workshops, and then assign these 2 groups into community center so that they can access to the volunteer activities. Okay, and then we use the HinCare app. HinCare app, it is a digital platform to record their volunteer hours, and for the time bank group, we automatically convert their volunteer hour into the time credit. And then for the time bank group, we also provide the reward sessions for the time bank group. For example, we collaborate with the social enterprise, and then we offered the time bank group with the rewards like cookies produced by the individuals in the mental health recovery program. So, which means that reward themselves, it is not tangible goods. It is like social values. I present them with the social values. So this is apps to record the time credit and to do the time credit exchange. So this is measurements, but I won't go into details about the measurement. I'll go into the finding. So this is sample description, but I will skip it. But basically, we found that these 2 groups are comparable, except for the age and the volunteer years. So in time bank group, the average age in the time bank group is younger than the control group. And then one of the interesting things that we collect data about the volunteer hours. Let me explain. I need to explain this one. So we collect the volunteer hours within the time bank, and we collect the volunteer hours beyond the time bank. Okay, so because we want to see whether there's a crowding out effect, we should to collect these 2 parts of the hours, volunteer hours. And for the within time bank volunteer hour, we use the objective data because we use the HinCare platform. We have all the objective data. And for the beyond time bank hours, we just ask them to self-report the volunteer hours. And then the total volunteer hour is to the sum of the A and B, or within and beyond the time bank. Okay, so for the first questions, we can see that within the time bank volunteer hours, we can see that time bank group have a significant higher volunteer hours than the comparison group over the time. We have the 3 time point collection, data collection. However, for the beyond time bank volunteer hours, time bank group displayed a marginally significant increase in volunteer hours beyond time bank program compared with the control group. Okay, marginally increase, which means that actually when you compare the volunteer hours within time band and beyond time band, there's no crowding out effect. There's no replacing effect. So when I use the sum of the volunteer hours to show the effect size, we can see that in the last data point is that time bank group shows significant larger effect in increasing volunteer hours than the comparison group. So I additionally asked their volunteer intention. So when you do the comparison, we can see the time bank group also shows significant larger effect, increasing the level of the volunteer intention at the time point 1 and time point 2. So for the question 2, we do some mixed model analysis with the interactions to test the interaction effect. So I think that the picture won't complicate enough. So we examine the interaction with that age, cross time bank, or this is intervention condition and the time. Here we can see that the people age 65 and above have a larger effect in terms of the volunteer hours compared with other groups. So this is in the people age 65 and above within the time bank group, and this is others groups condition. And education, this is a low education within time bank group. We can see that the volunteer hours over the time within the time bank program is also higher, significantly higher than other groups. And for the people with multiple chronic disease condition, we can see that people within the time bank group have multiple chronic illness also increased their volunteer hours over the time than other groups. So actually, from the literature, these two groups are traditionally excluded from the volunteering program. So the question 3, it is to explore whether there's health effects or quality of life effects generated from the time banks. So I know the model may be complicated, but the key message is that time bank can influence the volunteer hours over time, and that further impact on the self-efficacy in the volunteering, and then increase the quality of life. And when we test the mediating model, so it is still significant. So for the discussion, we found that time bank increased volunteer hours with marginally significant evidence of the positive spillover effect on the volunteering activity outside the time bank program. And in the past, scholars raised some concerns regarding the possibility of the formal recognition and system that might lower the intrinsic motivation for volunteering. However, our findings indicate this risk is minimal. This risk is quite minimal. So we try to understand why. Because this is quite different from the previous studies and evidence. So we actually conduct some qualitative focus group to answer our questions. And the time bank, actually, volunteers may mentally distinguish time credit from traditional monetary incentive because they perceive time credit as the tokens, as a symbolic currency. And this is also from our previous qualitative studies. And they adopt a tracking but not calculative mindset. In Cantonese, we have a term, 計而不算, which means that they mentally track their number of time credit and they regard it as achievement, success, contribution, rather than money. So that kind of mechanism may distinguish time credit from money, from a tangible incentive. So for the question 2, we also found that the effect of time bank on the volunteerism were especially strong for those aged 65, low education, and with chronic disease, and later to the marginalized subgroups in traditional volunteering. So we try to understand this phenomenon because time bank may help to lower the structural barriers through its time credit-based exchange system. So time bank actually can provide role validation for those marginalized individuals, such as retirees, people with low education, and those with the health challenge, because time credit can give them a role validation and can give them, okay, I recognize your contribution no matter your educational level, no matter your reputation, no matter your health conditions. And we also find the finding evidence to support time bank can indirectly promote quality of life over time. So I will skip the policy implications because I noticed the time is limit. So limitation. Okay, future research direction, because I want to use this platform identify the collaborator, to ask for the collaboration. Because we use the digital platform to record the exchange behavior and exchange data. Over 5 years, we have over 6,000 users, 100,000 transaction records, and this data nested in 20 NGOs. So we have a large objective data set, which means that compared with the previous study, the previous study used the self-report, social exchange, or mutual support, and social support scale, something like that. However, we have the objective data. So we want to use the social network analysis to identify different kind of patterns and link it to the healthy aging outcome. So anyone who are interested in social network analysis and with expertise in this aspect, please, we want your collaborations together to explore more patterns and then how to promote the volunteering to achieve healthy aging outcomes. So I will skip the third one. The third one is still developing. So thanks.